common is ED in young men? Erectile dysfunction becomes more and more common as you age, but it can also affect the younger male population. However, this can be a sensitive subject to talk about for many people, so they tend to deal with it silently. Let's check out things you need to know about ED in young men. ED in young men and what you should know about it. What is ED? An erection involves the hormones, nerves, brain, muscles, and circulatory system. These systems work together to pump blood to fill the erectile tissue in the penis. Erectile dysfunction, ED, is the condition in which you are having trouble getting, or unable to maintain, an erection for sexual intercourse. In some cases, men are entirely unable to get an erection, which makes ED known as impotent at one point. ED is usually more prevalent among older men, but it can also affect a large number of young men. According to researchers, about 8% of males in the age group between 20 and 29 and 11% in the age group between 30 and 39 can be affected. What can cause ED in young men? A variety of causes contribute to the development of ED in young men include physical causes. Diabetes. ED might be considered a sign of diabetes due to the high level of blood glucose in your body, which can damage the blood vessel, making it difficult to supply blood to the penis during an erection. Obesity. Being overweight can be a risk factor for hypertension and diabetes. Heart problems. Blood circulation is absolutely crucial for getting and maintaining an erection. Meaning if you have heart conditions such as clogged arteries, getting and maintaining an erection is a hassle for you. Hormone disorders. Low levels of testosterone can contribute to ED in young men. The best way to solve this is to seek help from doctors and other healthcare professionals such as Opt Health, where you can quickly get the treatment you need. Psychological causes. Get ready for the erection. That's why having anxiety and depression can interfere with that process. Besides, stress from life events and relationships with poor communication can also contribute to ED in young men. For some men who are well known for drug abuse and excessive alcohol intake, this can cause ED. How common is erectile dysfunction? According to one study, erectile dysfunction affects approximately 5% of men under the age of 40 and 15% of men over 70. About 10% of males develop mild to severe erectile dysfunction during their lifespan. Though there hasn't been much research on the number of young males with ED, the numbers seem to be becoming a lot more than in the past. What is the fastest way to cure ED in young men? Key treatment for ED varies depending on the severity of your condition and physique. But usually, they are treated with medications, injectable and oral, hormone replacement therapy, HRT, penile implants, vacuum erection devices. However, it's always better to prevent it from happening rather than treating it when it has already occurred. Steps to help you reduce the risk of erectile dysfunction. Reduce stress. Quit smoking. Exercise more. Avoid or limit your alcohol intake. Stop using drugs with harmful effects. Have regular checkup, and have doctors check and monitor blood pressure, blood glucose level, and cholesterol level. Maintain a healthy diet and body. Going to the doctor may seem to be a logical solution for treating your ED. It can be a lot of hassle as you have to make frequent trips and have some uncomfortable talk about your sexual life. But thanks to today's advanced technology and services, that can all change. There's no need for making trips to the doctor and having awkward conversations about your condition. If you like the video, give it a thumbs up and share it with your friends. If you want more tips, subscribe to the channel.